Hey everybody, it's Dr. Eric Balcavage of Rejuvigen. In today's episode of Thyroid Thursday, I'm going to talk about magnesium. Now, I run hundreds and hundreds of blood panels every year, and magnesium is the #1 deficiency I see. And so we need to talk about it. So what is magnesium? It is an essential mineral in the body. It's probably the fourth most abundant mineral in the body. And it's an essential mineral, which means your body can't make it. You have to get it from your food, okay? It's critical to somewhere between 600 and 800 enzymatic reactions in the body. So it's critical to optimal function and physiology in the body. Problem is, most people are deficient in it. So why are we deficient? Well, I'll give you 5 good reasons, but there's more than these. Number 1 is it's not in the soil. We rely on big mass farms to produce our food, and when they're constantly farming the same ground over and over, those crops pull minerals out of the ground, and unless those farmers, these mass farms, are putting those minerals, especially magnesium, back into the soil and testing to make sure there's optimal magnesium levels, your food's going to be deficient in magnesium. If your soil's deficient in magnesium, the food's deficient in magnesium, then there's no way you're going to get sufficient levels of magnesium from your diet. So that's not one reason. The second is decreased absorption. Many people have decreased stomach acid production, and lots of stress can reduce stomach acid production, but it's a really common issue. Anytime you have decreased stomach acid production, you're going to have decreased magnesium absorption. Anybody who has hypothyroidism, and it doesn't matter if it's cellular hypothyroidism, subclinical hypothyroidism, Hashimoto's, or primary hypothyroidism, you're going to have decreased stomach acid production. That's just what happens when you have hypothyroidism. You can't make as much stomach acid. Therefore, you're going to have magnesium deficiency. Third, many of the medications people take for different conditions deplete your magnesium. Fourth, stress. Anytime you have chronic stress, you deplete your magnesium faster than you should. And fifth is iron dysregulation. Iron dysregulation is highly associated with magnesium deficiency. So those are just 5 reasons, and there are many more. But what's really important for you, those of you who struggle with hypothyroidism, there's a high correlation between magnesium deficiency, hypothyroidism, hypothyroid symptoms, and Hashimoto's. So it is critical that if you get tested and you find out you have hypothyroidism, or you just have hypothyroid symptoms, you should get your magnesium levels checked. And it's ironic, but magnesium deficiency symptoms are very, very similar to the symptoms we see in those that have hypothyroid symptoms, okay? So those 2 things can correlate. We often see that if you have magnesium deficiency, you're gonna have hypothyroid symptoms, and if you have hypothyroidism, you probably have magnesium deficiency. So we see a high correlation of those things. How do you test it? And that's the big issue. Most people don't get the right test done. Now, what clinical research shows right now is probably the best way to evaluate your body's level of magnesium is by doing a muscle biopsy, but most of us aren't going to get muscle biopsies done on a regular basis. And the reason the muscle biopsy is probably a better test is because 99% of the magnesium in the body isn't in the bloodstream, it's in the tissues. So when we look at serum magnesium on a regular blood panel, the body really fights to maintain magnesium level within that lab range. And so it's not a great indicator of what's going on inside the cells. So the best proxy we have to look at what's going on in the cells that's cost effective is something called RBC magnesium, your red blood cell magnesium. So we can measure how much magnesium's in the cell and kind of use that as an indicator of what the full body status is. And so what you need to do anytime you're getting blood work drawn, you should ask your doctor, demand that your doctor run RBC magnesium. And if they tell you they're going to run it just a serum magnesium, that's good enough. It is not good enough because only 1% of your magnesium is going to be represented in that blood. 99% is in the tissues. The RBC magnesium's a better indicator of what's going on inside the cells. So here's the numbers you need to kind of keep in mind. If you get your serum magnesium tested and it's less than 2.0, that's considered a magnesium deficiency. And if it's low in the blood and the body fights to maintain serum magnesium and it's only 1% of the body's magnesium, if your blood's low, your tissues are deficient, okay? Keep that in mind. The other marker, RBC magnesium, is the one I really recommend on a regular basis to get done over the serum magnesium, but both are fine. But this is the one you definitely need to get done. We want to see this number greater than 6.2. So if your RBC magnesium is less than 6.2, you've got a magnesium deficiency. So you got to run at least the RBC magnesium, but you could definitely do both those tests. Now, if it turns out you're magnesium deficient, you want to start increasing the magnesium in your diet. You can take supplemental magnesium. You can do Epsom salts bath, magnesium sulfate baths. You can use magnesium chloride spray to put on your body. There's a number of ways to get in there. The last piece on here is not all magnesiums created the same. So if you go to some of these places, you get real cheap magnesium, you're going to find out that it's not very absorbable. You're going to wind up having loose bowels long before you get absorption of magnesium. So some of the chelated or albion minerals are probably some of the best forms of magnesium. But if you are deficient, work with a functional medicine practitioner like myself to help you understand the best type of magnesium to take, because there's lots of different types of magnesium. There's magnesium citrate, magnesium oxide, magnesium threonate, magnesium glycinate, magnesium malate. So all the things that the magnesium is attached to are important, and some people do better with different forms, and some forms are more appropriate for certain situations. So again, have your magnesium tested. If you have hypothyroid symptoms, make sure you get it tested every time you get blood work done, and demand that you get your RBC magnesium tested. If you're deficient, work with a functional medicine practitioner to figure out what's the right form of magnesium and how much magnesium you should be taking, and make sure you retest your RBC magnesium levels regularly to make sure that you're actually absorbing it and getting to a more normalized value. All right? Hope that helps. Take care, everybody. Stay tuned for another episode of Thyroid Thursday.